Acclimatization. So acclimatization is a process that basically takes place for people that are adjusting to high altitude. So let's talk about a story. So you learn about physiology, you learn about this process. Right now you probably don't know what it is, but again, pretend you do, right? And you realize, because I learned a little physiology and I was never really good at sports or something like that, you're thinking about it. And I want to become a very good athlete right now because I'm bored and I want to create some kind of hobby, right? So you read up that a lot of these people, the key in endurance is in elevating your red blood cells, right? So everyone's always trying to elevate their red blood cells in order to increase their stamina, right? And so you're like, I don't want to take steroids, I don't want to take growth hormone, I don't want to take any kind of blood doping EPO, right? So any kind of synthetic EPO to generate red blood cells. Because you realize even though they're very effective, the side effects of them are almost substantially high and you don't want that, right? So you decide, okay, I'm going to go into and train, because you read about high altitude trainers, right? So people that go in the very high altitudes, they experience instances of hypoxia, right? Because the partial pressure of gas is very low. And you think, okay, I can handle it. Let me go 3,000 meters or 3 kilometers in the mountains and begin my training process. I'm gonna do exactly what I'm doing here, right? But instead I'm gonna go up in the high altitudes, right? And you realize, okay, without even preparing yourself, you just go into high altitudes, you begin training, right? You start training after a few hours, and then you notice certain kinds of symptoms that take place. Your head starts hurting, right? So you have instances of headaches. You get dizzy. So you get headaches. You become very dizzy. You become nauseous. Right? So you want to throw up, right? So dizziness. Nausea, right? And you're wondering what's going on. My breathing, I'm beginning to hyperventilate, right? So you have your respiration begins to increase, right? And so the reason for this is when you go into very high altitudes and you begin this training process, remember in high altitudes, there's a very, very low partial pressure of oxygen, right? Compared to sea level in high altitudes, right? This low partial pressure of oxygen prevents anything, for example, your red blood cells to become completely saturated, right? So this inhibits the saturation process, or it takes a much longer time, right? And this problem can actually become very lethal, right? So this is called high altitude sickness. So all these symptoms that you're experiencing, this is called high altitude sickness, right? So when you're in very high altitude, you experience very high symptoms of sort of anemia, right? Your breathing changes and everything. And so this high altitude sickness is usually compensated by this process called acclimatization, right? But again, this process is a very slow process, and in order to maintain this phenomenon to happen, right, it needs to be on a very gradual level, right? High altitude sickness, if not taken seriously, right? So you're like, you know what? I'm going to push through it. This can actually be lethal, right? This can lead to instances of, for example, pulmonary edemas. So you have buildup of fluid in your lungs, which can give you problems with gas exchange. This can be any kind of edema with the pulmonary system and also the cerebrum. So it can lead to cerebral edemas as well. So you have buildup of fluid in your brain. So very, very lethal condition. So you have to be very, very careful, right? So you have to take it easy, right? You have to go slow, right? Relax. You don't need to become the best athlete in the next 2 months, right? Give yourself 2 years, 3 years. Now you're saying, 3 years, that's too long. That's not, I'm gonna get over it. Well, then maybe you should look at your priorities and what's really going on, okay? And so acclimatization is a process where your body compensates this low partial pressure of gas by either amplifying certain receptors or increasing the process of erythropoiesis, right? So erythropoiesis, we have these specific types of stem cells in our red blood cells called hematopoietic stem cells, HSCs, and they differentiate into red blood cells, white blood cells, and cell-fragmented cells, like known as platelets. Erythropoiesis is the process of hematopoietic stem cells differentiating into erythrocytes or red blood cells. right? And so this physiological phenomenon increases. And this is what a lot of athletes go for, increase in this red blood cell count. Because if you have increased red blood cell count, you have an increased carrying capacity for this gas, right? So you can take in more oxygen, so your stamina will become more efficient and built up, right? And so this process, when we look at here, one thing is really important is during this physiological phenomenon is your chemoreceptors, specifically your chemoreceptors regarding your carbon dioxide, become hyperstimulated, right? They become more sensitive. And because they notice this high partial pressure of CO2 and low partial pressure of oxygen, it begins their ventilation process. It increases ventilation, so you begin to breathe more and more and more and more, right? Next, what happens is if this is not working, you have this process of erythropoiesis taking place, more erythrocytes to begin, right? And so one thing that's also important about the increased ventilation, when you increase the ventilation from the chemoreceptors, your actual respiratory rate, that's where we can put it, we have enough space, to 2 to 3 liters per minute. So your respiration throughout the day, in terms of volume, increases about 2 to 3 liters per minute in a day, right? So this ventilation process that's generated from the chemoreceptors from the carbon dioxide causes this physiological phenomenon to activate, right? So the chemoreceptor is either in your peripheral or central, goes in and stimulates your central pattern generator in your pons and your medulla in order to begin this inspiratory process, right? And so if this doesn't happen, this doesn't work, this stimulation also causes what all these athletes are looking for is the secretion of EPO, natural EPO, right? Erythropoietin. And what's the erythropoietin's function? Erythropoietin's function is the generation of erythrocytes, right? So more EPO, more erythrocytes, right? Okay, and so increasing the erythrocyte count increases the probability of oxygen binding to hemoglobin and releasing it into specific tissues that is necessary, right? Because if this process doesn't take place, right, red blood cell count's very low, our oxygen is very low, the tissues doesn't necessarily have any kinds of form of metabolite. They have sugar, right? They can have shield, but sugar can only go so far. So then the actual tissues begin to necrose because of the lack of oxygen. And this necrosis or death, tissue death, can eventually lead to organ shutdown, and eventually it can become so lethal that you can actually die.